So we're back here with Manya and we're demonstrating her seated cervical traction. Now, the way that this works, the reversal of the traction is at C2. So we've got this strap here at C2 going in a superior upward pull, and we have a chin strap that's pulling back for stabilization. Most of the work is happening in this forward pull. We've got 10 pounds here, we're pulling forward, we'll do the in-office traction for 15 minutes, and she just relaxes into it. Please notice that I've got this wedge up here to keep her body more upright so that she doesn't extend this way from the back pull. So we've got her nice and balanced, and just like the home traction, the in-office traction has time as a component. The traction is all about remodeling the ligaments. And by holding her in this corrected position for over 10 minutes, which is the minimum, that's when the ligaments stop fighting and they start to remodel. We get up to 15 minutes, and each time we do this, it creates a little bit more correction. Then she supports it with her home traction, the in-office adjustment, the home traction, the therapeutic exercise, and as a program to get spinal correction, to get postural correction, we take the stress off the nerves, the body heals, and then the symptoms go away. We don't chase the symptoms in the sense of like, I'm not treating the neck pain, I'm not treating the radiating pain, I'm trying to correct the subluxation, the misalignment, and by doing that, the body heals itself. Before there was ever a chiropractor, before there was ever a medical doctor, there was a body that is self-healing and self-regulated. We just have to take the stress off of the nerve system because we heal through the nerve system. If we take the stress off the nerve system, then the body can heal itself and do amazing things. Thank you so much.